My novel therapy was streptokinase. So what is streptokinase? When introduced into the circulatory system, it indirectly lyses fibrin. Streptokinase is produced by beta-hemolytic streptococci and is used for the treatment of blood clots. It is also referred to as a clot buster. As a side note, all beta-hemolytic means is the complete breakdown of the hemoglobin of red blood cells in the vicinity of a bacterial colony. Streptokinase can be used to treat acute myocardial infarctions, also known as AMIs, acute ST elevation myocardial infarctions, known as STEMIs, deep vein thrombosis, pulmonary embolisms, arterial thrombosis, and arteriovenous cannula occlusions. Much of the research that I did found it to mainly be effective against AMIs and STEMIs. So how does it work? It is going to activate plasminogen, which is bound with fibrin and forms the actual clot, and converts it to plasmin. Plasmin works by lysing the otherwise insoluble fibrinous clot and essentially dissolves it. Streptokinase is produced as a streptococcal virulence factor. As a virulence factor, it is critical in the pathogenesis of invasive streptococcal infections and promotes bacterial invasion in the body. It also prevents the innate immune system from killing the bacteria off, as the streptokinase and plasminogen complex can degrade extracellular histones, which are antimicrobial proteins that complement the innate immune system. So how can we harness streptokinase and use it in such a way that won't be a danger to us? Scientists created recombinant streptokinase using PCR. First, collection and isolation of a beta-hemolytic streptococcus would need to occur. Next, the streptokinase gene would be amplified with the utilization of bacterial DNA. The streptokinase gene is then cloned and transcribed into a eukaryotic expression vector, which can just be a plasmid. The synthesized RSK protein is then purified. Okay, so streptokinase more so improves short-term survival rates as opposed to long-term. 6 weeks after receiving streptokinase, survival rate was at 94%. After 3 years, survival rate was at 84% and continued to decrease as time went on, which can be visualized by this graph. In this study, streptokinase was compared to the usage of anticoagulants. So what are some drawbacks and issues? Streptokinase can cause adverse drug reactions to occur. The most common adverse drug reactions are chest pain, hypotension, coughing, and ecchymosis, which is just bruising. Streptokinase is also a non-human protein and can lead to severe anaphylactic responses and even death. Streptokinase can really only be given around every 6 months to a year due to the formation of anti-streptokinase antibodies. It is also non-fibrin specific, making it less selective in action, and it leads to extensive systemic plasminogen activation, which creates more anti-streptokinase antibodies and creates more of a risk of bleeding more heavily from injuries. Streptokinase may be the least expensive and most effective, but is considered a bit inferior to tissue plasminogen activator drugs such as alteplase, reteplase, and tenecteplase. Tissue plasminogen activator drugs show improved outcomes in AMI treatment. It is important to note that streptokinase was a predecessor to tissue plasminogen activators when it was first discovered and used in clinical trials. So just to summarize everything, streptokinase is a bacterial protein that is produced by beta-hemolytic streptococci and acts as a thrombolytic agent. It works by activating and converting plasminogen to plasmin. The plasmin then lyses the fibrinous blood clot. Streptokinase is a streptococcal virulence factor that promotes bacterial invasion in the body and prevents innate immunity from killing the streptococcal infection off.